Thank you. Aloha, everyone. Thanks for being here. For those of you who are working on the ground on Maui, I don't think the data is going to be new, but it's just a different way of thinking about it because you've seen and heard and felt a lot of what I'm about to present. Some of you know me as the interim director of Maui United Way, but my day job through my entire career has been a survey researcher and a pollster. The first work I did was in Hawaii was in 1990 for Senator Akaka's first successful bid for the U.S. Senate. I'm a 16-year resident of Lanai, and I conducted the research 2 years ago that Greg referenced earlier. And we have the beauty for us nerds of being able to do some analysis over time. So just to jump into it, and I also just want to let you know that, well, I'll get there, but to look at the methodology, we did a bunch of things starting in February, and that was, we did online focus groups with healthcare professionals, both primary care and behavioral health specialists, 2 different ones on Maui. We did a collective group of healthcare providers on Molokai, and the same thing on Lanai. After that, we did focus groups among the fire impacted community, and then one group of disaster leads and hub folks working at the private hubs. Those were all done mid-March. There may be people on this briefing who participated in that. The value of those conversations made this research much more successful because we knew exactly the questions that we needed to ask. Once we got done with the focus groups, we went into the field, and I want to be clear that we were in the field May 20th through June 6th. So the data is about 6 weeks old. It's in pollster timelines quite fresh. And we have a lot of comments throughout the survey. The comments came from the May 20th through June 6th survey. These are not dated comments. We had beefy samples, a survey of over 2,000 residents, 2,097 Maui County, and 1,105 fire impacted individuals as well. Maui United Way was a survey sponsor in that we had a data agreement with Maui United Way in order to query the individuals that went through their emergency financial assistance program. We also asked direct questions and a set of direct questions that allowed people to be considered a fire impacted individual. The survey was translated into Spanish, Tagalog, and Ilocano, and I want to thank some of our friends, Amy Peterson in particular, in Lahaina, who beseeched us to translate it in Spanish. All of the interviews that were conducted in Spanish were among the fire survivor community. The way we conducted this survey was it was an online text to web. We provided online panels, and we used email addresses. We also went old school and sent postcards that contained a QR code asking people to participate. We did that to make sure that we could get the saturation we needed on Lanai and Molokai. But those postcards were also sent across Maui County, not to every household, but in a random nature. The postcards were written in 3 languages. The invitation to participate in the survey was in 3 languages on the postcard: English, Tagalog, and Ilocano. We also weighted the sample to make sure that it represented the true demographic representation of the county based on the 2020 census data. We have really small margin of error on each of the data sets, plus or minus 2.1 percentage points at the 95% level of confidence countywide, and plus or minus 2.9% with the fire impacted sample. We also did a survey of healthcare professionals. 57 professionals participated. There is no margin of error, and it's going to be kind of squishy because not every healthcare provider across Maui County had an equal chance of participating. We were moving it out through networks, especially the Project Echo list from the Hawaii State Rural Health Association. That was conducted mid-June. We do have a lot to offer about what they say, but that's one where there might be just a bit of grain of salt in terms of the statistical numbers. It's important to understand that most of you do that the fire impacted sample does not resemble the county as a whole in a whole bunch of really important ways, especially their socioeconomic status. We knew that Lahaina was a struggling, working class, very diverse town before the fires, and not surprisingly, that fire sample reflects that. They're much more likely to have a high school diploma as opposed to a college degree relative to the county as a whole. They're more likely to be underemployed. They're more likely to earn less than $40,000 a year. They're considerably more likely to speak a language other than English in the home. 43% of our fire survivor community does, especially Spanish, but all of the language, a whole array of languages. We knew that there are 6 languages commonly spoken prior to the fires. 25% of the county is speaking a language other than English in the home. It's 43%. The other really important thing to understand is that roughly 53% of our fire survivor community is living in West Maui, and the rest are, I'll talk about the folks who have left, but the rest are spread across the island. The fire impacted community that is in the Kihei area or upcountry are struggling mightily, especially compared to West Maui. The folks who've been displaced from that side of Maui are hurting more than the folks who are living in West Maui, which is not saying a lot because both groups are in really dire shape. The whole county is, and that's the most important takeaway, which is our fire survivor community. It's devastating. The county numbers are not much better. In terms of where people's heads are at, we asked if they feel more hopeful or worried about the future. 78% countywide said they felt more worried. 76% of our fire impacted community felt that way. 79% of our healthcare professionals said that they felt more worried than hopeful. And when we asked them to describe life right now, regardless of who you talk to or the sort of different cohorts within the sample, struggling, stressful, survival, chaotic, expensive, surviving was a word used often. There was a few folks that expressed some gratitude, but mostly it was trying to keep their head above water. We offered a list of personal concerns and said, how much do you worry about these things? And the answer codes were, do you worry a great deal, some, not too much, or not at all? These really high percentages I'm reporting here are the percent saying this worries me a great deal, not the sum, just a great deal. And you can see how high the numbers are. You don't need a pollster to tell you that the high cost of living and affordable housing are at the top of the list. The blue bars are the county as a whole. The orange bars are fire impacted. And you can see where the numbers start to really pop out with our fire impacted communities. More inclined to worry about the cost of living, more inclined to worry about stable housing, more inclined to worry about how uncertain the future seems. I'm going to punctuate that point later. The other thing that I thought was interesting was that we had more of our fire survivor community, 64% saying they express a great deal of concern about kapuna and elderly kama'aina by a margin of 5 points than they do about children and young people. That's not to say that we don't have people saying our kids need more activities. I'm concerned about mental health with our keiki. What I think the message here is, let's not forget about our kapuna, right? I was also, sad to see, but not surprised by the fact that by a margin of 20 points, our fire survivor community is very concerned about another devastating fire. In the focus groups, people talked about all the triggers, the tsunami warning, hearing ambulances, wind blowing, high winds, all those things are triggered. This person said, I'm also disabled and have a newborn, and with 2 elderly people over 70, so I'll probably just die in a fire. We measured the social determinants of health, and what I'm showing you is rank ordered by least available across the county. And then again, we see the fire impacted folks. It's just greater emphasis on all the problems that the county is experiencing. Being able to have money and savings is elusive to a lot of people, 62% among our fire impacted community, 55% countywide. Having access to long-term stable housing, not surprisingly, big numbers on both sides, but 11 percentage points higher with our fire impacted crew. Good paying job, affordable food. It all tells a story of economic security. And I've been telling people that I feel like we're not using the P word enough, and I mean poverty. Another one of the questions we asked 2 years ago was, is your financial situation, there were 3 questions. Is your financial situation, your physical health, or your mental health about this better or about, better, about the same, or worse than it was since since the pandemic. Sorry, in 2022, we said, since the pandemic. This was August of 2022. We re-asked that question, but said since the fires. What we see is that countywide, 49% of the entire county is saying that their financial situation is worse since the fires. That number was 31% coming out of the pandemic. So the sort of double whammy of the pandemic and the fires have had a multiplier effect in terms of people's own financial status. Look at the number among the fire impacted. 69% of our fire impacted families, again, this is all things you see. It's just a different way of knowing what you see, right? 69% say that their financial situation is worse. 52% of our fire impacted samples say that their physical health is worse, and 64% say that their mental health is worse. We also see that across, compared to 2022 on physical health, the numbers are a little lower, but we were coming out of a pandemic, right? So there was, obviously health consequences across the county with that. This is one of the questions that I've been talking about a lot, and it breaks my heart. We have 60% countywide saying that they've had to cut back in the past year on food and groceries because they're short on money. That number jumps to 71% among our fire impacted folks. In 2022, I was alarmed that 54% were saying that. It's now 6 percentage points higher countywide, and then much, much higher among those fire impacted folks. Same with foregoing healthcare and medicine for financial reasons. The number was 27% in 2022. It's now 40% countywide, and we have a majority of our fire impacted people saying they're foregoing these things. The numbers are even higher among our Pacific Islander and Native Hawaiian populations in terms of foregoing groceries, and some of the single heads of households, people lower income residents of Maui County, and some of our MedQuest patients as well. The thing that I love about the polling that I've been doing for now 3 decades, I guess, in Hawaii, is that people really like answering open ends. And most of the people took the survey on their phone. And I don't know how long it must have taken him to take the survey, because they wrote volumes. I had to sort of tsunami of verbatim responses to analyze. And to me, that's an indication that they still haven't been heard. And that's what we heard in the focus groups too. I have never been thanked more as a focus group moderator in my extremely long career for just going to the focus groups and listening to people. It wasn't that I was good at it. It was that I came and asked questions. Finances are a tremendous struggle. My husband is currently fighting cancer and kidney failure. We have accumulated approximately $60,000 in credit card debt, along with other loans and expenses. The cost of food in Maui is higher than I ever remember to be, and I've lived here for about 53 years. Gas prices are extremely expensive. It's difficult to survive. I'm still working at 71 to make ends meet. I have 2 full-time jobs in order to sustain our living and able to pay mortgage and utilities. That other quote that I was just struck me too is, it's very hard to afford living here. I have to work more hours just to barely make the cost of living. That came from a healthcare provider. And in our small sample of healthcare professionals, the disproportionate number of people were either RNs or doctors. So we have providers saying, I can't afford to live here. And so leaving starts to become an option. We asked people if they knew of folks who have left Maui since the fires. I'm sure you would all raise your hand to say you do. I'm going to direct your attention to the bar on the far right with a rectangle around it. Only 6% of our fire impacted community does not know anyone who has left. So their community has unraveled. They've been, almost half have been displaced, and they know people who have left. They've lost people, and now they know people who have, 94% have knows someone who's, at least one person who's left the island. 81% of our fire impacted community says that they know friends who've left. 58 have no neighbors. 56 know coworkers, and then 48% say that they have family who have left. So their ohana is gone too. Looking countywide, 65% have friends who have left. They've got, about a third have lost neighbors and coworkers. And those things can start having a kind of a snowball effect if we're not careful. we called the question and said, how seriously are you considering leaving the island where you live and moving somewhere else? We have 39% saying they're considering leaving countywide, 45% among our fire survivors. As a person who has spent my life trying to understand how to motivate people and to gauge what that motivation levels look like, I tend to look at the very seriously. If you're not very anything, you're probably not really considering it. But we have 16%, almost 1 in 5 in the county thinking about it, and over 1 in 5 among our fire impacted communities saying they're seriously thinking of bailing. When you look at the people that have already moved, because we got to have some of those folks in our sample, they tend to be relative newcomers. People have been on Maui less than 5 years. They were Caucasian. They tend to be a little higher income earners, 80 to 100K. 55 and older women and older college graduates. We looked at where they've gone, and this is ranked in order of where they've said they've moved. Oahu and Hawaii Island, California, Vegas, Washington, Arizona. We've had people move back to say that they've moved back to Mexico and Guam have taken our survey, and then people that are scattered all over the continent. The fire destroyed my home. I'm a boat captain. All the boats were destroyed. I had no choice. I'm going to Kona now, but I'll come back when things come back. We lost our home in the wildfire and couldn't afford to stay on island and couldn't find affordable housing with our family of 5 and 3 dogs. I lost everything I owned. I can't afford to live there anymore. I'm in sadness and survival mode. I'm still integrating, evacuating from the fires and leaving island with my daughter. It's been a hard transition. We grieve a lot, feel like fish out of water, and it breaks my heart. My daughter will no longer grow up in Hawaii, being she's Native Hawaiian. Our healthcare professionals are in largely the same boat. We only had 33% saying they weren't thinking about moving, reducing hours, retiring. And so, you know, they're considerable flight risks. This is something we reported on 2 years ago, and it's only gotten worse. 4 in 10 say they're contemplating a reduction in hours. Almost 4 in 10 say they're considering moving to the continent. 35% are considering retirement. We had a doctor in one of our Maui focus groups who has a patient load of 3,100 people and no one to turn it over to, and he wants to retire. I don't know what's going to happen when he does, right? Or just closing their practice a quarter, say, or just quitting. I like what I do, but I do too much for too little reimbursement. I have already cut back my hours. I'm considering early retirement. I am so burned out, said one healthcare provider. So let's turn to our fire impacted individuals. As this fire survivor said, we not only lost our past in the fire, we lost our future also. One of the things that we learned from the focus groups with the fire impacted community was that this general feeling that they felt as or more traumatized by what happened to them after the fire than the fire themselves. It did feel like this whole process, even with the reopening and stuff, was just gaslighting us to feel like this was not bad, but it was so bad. And I feel that that's what needs to get across to everybody, that this was like so bad and it's really hard for everybody and that it's not something that can be fixed. And even once the dust settles and all that, it's just going to take a long time. And the community, you know, is gone. We used to be able to do all this stuff, walk, bike, go to the shops, go to the restaurants and everything. Then FEMA placed me in an apartment up in Napili, where it's a lot different from mine. I can't complain, but it's like living in a hotel, you know, there's different people coming in all the time. I feel like I'm on a cruise ship. I don't know anybody on this cruise ship. We have 27% of folks saying that they were directly impacted. Again, you had to jump through a bunch of hoops to qualify. But we have another 45% that's saying they were indirectly impacted. And Maui and Lanai, you know, Maui obviously heavy concentration, Lanai too, because we lost our ferry from Lahaina. That's had some real impacts on our economy because we lost our day trippers. And then when you look at loss, it was very clear from our focus groups that people were readily admitting that they had a lot of cash stashed in their homes and lost that too. We had one Filipino woman in our focus group who said that at one point while they were evacuating, while their roof was catching on fire, they had to have a family member from the front seat crawl in back to keep Tutu from jumping out of the car to go grab her money because everything that she had was in that house. We have 53% of our samples saying that of our fire impacted samples, so they lost cash, 61% lost housing, 52 lost friends, 42 lost a job, another 32 a business. 17 lost pets, and 13% lost family members. Obviously, those are not mutually exclusive. A lot of people lost a lot of things on that list. I lost everything. We lost our home in Ohana while running from the fire to the beach, pushing a wagon laden with food, water, and towels, being thrown around in the high wind gusts, branches and sand debris blowing. I fell and have had leg trouble ever since. Co-payments are exorbitantly high. I've had x-rays, but cannot afford an MRI. My 90-year-old mother has been rendered blind and can no longer walk and has some other issues since losing her house and its contents. Her depression must be off the charts. Her whole life was her Lahaina home and garden. We have people telling us that they're in temporary housing. Again, we were in the field in June. At that point, we still had end of May, early June, had 12% saying that they were in non-congregate housing. We know those numbers have gone down, but they still exist. 41% were in a housing that is a rental unit or a condo. I think it's really worth underscoring that we have 22% of our fire survivors living in what they consider temporary housing with friends or family. We've all heard about the carport conversions and what people are doing to take in fire survivors. But we know that the culture around multi-generational households, and this is sort of that on steroids, where we have people thinking that they're sort of couch surfing or temporarily shacked up with family and friends, and it's a decent number of people, 1 in 5. We only have 18% saying that they're currently living in permanent housing, and we had 3% that were houseless. We had a houseless person in our focus group who was a school teacher who lost everything. And we all have heard the stories about the love notes, as one person refers to it, the eviction letters coming under the door with 24-hour notice, and how many times people had to move. We wanted to quantify it. 59% of fire survivors have had to move at least 3 times since the fires. When you look at the people who've moved 5 or more times, it's 17%. I would also like to point out how owners of these units have been getting paid while they sit empty, and the victims of this tragedy are still being pushed to the side. The response time to absolutely everything in this situation has sucked. We heard a lot of that. And then it was clear that the non-congregate shelter and living in the resorts was re-traumatizing to a whole bunch of people, and they really explained why. And these are things, again, a lot of you know. But it's the mandatory check-ins every 24 to 72 hours, the constant worry about getting the note slipped under the door saying it's time to move. Living among resort goers, as one person said, it was the best of times and our worst of times. Another person was complaining about how, it's sort of girls just want to have fun. Girls trip next door, they're getting drunk, they're partying on the lanai, and they're sitting inside trying to figure out their insurance paperwork. And that was surreal for a lot of people, understandably so. It's also incredibly hard to travel off island, including for important events, funerals, weddings, baby luau, medical appointments, graduations. And they talk about lying to the Red Cross, saying I have COVID, I'm stuck in my room, so that they could sign in by text in order to get to a funeral or another really, life moment event. Not having a kitchen, we heard from parents with kids with dietary needs that needed, special food. Our diabetics, our people with heart conditions, not being able to eat in the way that they wanted to. How difficult it was for pet owners. This loss of privacy due to what, they called routine maintenance. We had one woman say, the number of times they've come in to do internal window washing is like nothing I've ever seen before. And they're not knocking next door on the people that are, resort people. So it felt like room checks in disguise, no real sense of community, the sense of uncertainty. And then the way that they felt they were treated, a perceived lack of compassion was something that we heard a lot about. They're actually more uncertain about the future than they are about not having stable housing. So 58% said when we asked what's been the hardest for you since the fires, it's the uncertainty. You look at how many times they've had to move and how long it's going to take for the rebuild and all those things, it's understandable, but those are really high numbers. The difficulty of navigating the system, running into dead ends, the impact on their own health, mental, physical, for themselves and their ohana was a little lower on the list. This is the slide that if I can get through without crying, it will be the first time, because this one breaks my heart. When you look at the people feeling most uncertain, it is Native Hawaiians, it is longtime residents, and it is Kapuna. The people in my mind who should have the least amount of uncertainty have the most right now. It's also the folks not living in West Maui. Kanaka are leaving because they can't survive here due to the increased prices. Housing for fire victims are not being built. I've been on those projects and they are a joke. Charging these families over what they can afford. Other residents are kicking out tenants to house fire victims because FEMA is willing to pay them more money. My kids will never be able to afford a piece of land or a house here. There's no longer certainty of life. I want to feel like I have control in my life. How uncertain, how long will it take to rebuild? I feel like we want to be able to have some sort of voice at the table. Adjusting to constant stress and like these anxieties that you have no idea, you don't have any answers. We had folks talk about their own mental health. Every time the wind blows harder, every time the ambulance goes by, I've not slept a full 8 hours in 7 months. I can't get help. 7 of them dropped me before I found a community center, and then I was on a waiting list. Fatigue comes quicker, a lot of mental fog. I also want to highlight this last quote because I think it's really poignant, especially for our mental health hui as we think about what comes next and the anniversary. I do feel like mental health is a huge issue now, and that should be a focus for a lot of people in recovery efforts. And now that people have a place that they can stay for a little bit and they have time to think, maybe they're not working with insurance people every day. I feel like now people are realizing, oh my gosh, this fire really affected me. And I think that's really an important point. We had folks in our focus groups who clearly needed mental health and grief counseling. PTSD was definitely rampant. And I'd ask, do you guys think you need it? No, I don't. We're good. And part of it is I think they don't want to cut, they were saying, I don't want to cut in line in case somebody needs it more than I do. But I also think that they were in survival mode. A lot of people still across the county clearly still think they do. There's no time for it. Looking at unmet needs, housing affordability was at the top of the list. We asked it in an open-ended question, and then we did use some AI techniques to collect the data and aggregate it into buckets. Just financial struggles more broadly. Healthcare access is lower on the list. Employment challenges, cost of living, and food security, and then those trauma pieces. In terms of trust of the advice and information they've received from government, nonprofits, and disaster relief organizations, it's a mixed bag. 43% say that they trust what they have gotten. 44% say they don't. I do want to point out that 7% said they trust a great deal of the information they've received, and 17% said they don't trust it at all. So a 10-point deficit on the mistrust side. When you look at who has the least amount of trust, it's the folks who are not on the West Side anymore. It's some of our college grads, especially those under 55. It's our Native Hawaiians and Caucasians, especially men. Some of our higher income earners, and some folks in that 45 to 54 age cohort. The people who tend to be more trustful are the current residents of Maui, and some of those lower income earners. In terms of satisfaction with the help and assistance, we have by margin of 14 points more folks saying that they're not satisfied than satisfied. And then 9% saying very satisfied, 3 times that amount, 27% saying they're not satisfied at all. Again, it's the folks who got displaced from the West Side who are less satisfied. It is our Native Hawaiian, our AJA, Americans of Japanese ancestry, and whites, men under 55. And when you look at who's most satisfied, it's the current West Side residents, Filipinos. If there was something that community was doing better than others, I think it's worth trying to understand that. And then a lot of folks that probably qualified for other poverty programs. It's low-income earners, MedQuest patients that may have had the sort of necessary paperwork to get them in the system. Another open-ended question we asked is, in what ways, if any of you, felt left down, frustrated, or ignored? And we said, if any. Government dissatisfaction, sort of more broadly, housing and rental issues, frustration with FEMA, lack of information, sort of the economic impacts were the things that people said most. Looking at some of the comments from folks, There was really no help and we had to move to Idaho to survive. Red Cross is the only people who helped houses at the Hyatt after the fires. Federal government is a joke and local people are suffering with no monies being paid out. We at Kapuna have been physically and mentally sick since the fires. What will ever be done to make this right? We lost 34 friends. Another person said FEMA and National Red Cross people are clueless about the needs of this vulnerable community. They use plans and models from the mainland, ridiculous for island culture. Let me remind you one more time that everything you're seeing here came at the end of May and the first part of June, and it was typed in a phone. So they say this, and this is really quite current. It's rough. We've been burned out of our residents and life is not going well. I'm thankful for Red Cross and FEMA, but there's much frustration with trying to find housing. Between the tragedy, trauma, and everything else, from seeming to jump through hoops and trying to get things done over and over, the same thing and always getting the same result. Feel like we're living the definition of crazy, doing the same thing and expecting different results. It's like they're already sick of helping us, like they're annoyed. Excuse me. And it really sucks because everybody's still in the same position, not knowing what they're going to do, not knowing where they're going to go. And now the rent is just skyrocketed because FEMA came in and just boosted the rent by giving all these landlords max amount. Unreal and ridiculous. Thank you, FEMA. And then this person at the bottom, very frustrated. Red Cross actually told me how hard it was going to be to find me housing due to having dogs, and asked if I was going to get rid of them in all caps. We had another person say, I didn't work hard to evacuate my dog in order to give it to the Maui Humane Society. I'm going to read you a long one. And this exemplifies, again, typed on a phone, exemplifies a lot of the stories that we heard in the open-ended questions in this survey that came out of the field on June 6th. My experience from the beginning were that people who came from the mainland, Red Cross, FEMA had their own agendas. They were not here to help, but to drive you insane. None of them I could give any straight answers to my questions. I think a lot of them came to vacation on Maui, so unempathetic to people's situations, so cavalier in their answers, heartless at times. It added to my decline in my mental and emotional health. Living in constant fear of being kicked out of the system in place was absolutely a horrible way of living. Hearing horror stories of families' plights, bouncing from one place to another with little warning, and having my own daughter's family, my grandchildren, who moved 15 times in 9 months with very little warning or no warning at all, was heartbreaking. It's an awful place mentally to be grateful on the one hand and angry at this crazy system that we're placed into because of a disaster. It really fucks with your mind along with the trauma going through this kind of disaster. You could never really connect with Red Cross agent or FEMA agent because they're constantly changing and moving around. They all had different answers and ideas about what I needed to do. Talk about navigating in utter confusion. That's been my life for 9 months. No wonder towards the end I felt insane, panicked, exhausted, exasperated, in fear, literally depressed, and sometimes just wishing I was dead so that all of this would end. The last Red Cross agent, he was on his own agenda, didn't even listen to what I had to say as I was explaining to him what was happening. Then he says, ma'am, I'm just here to help you, basically to cut me off. What an asshole. He was definitely not helping me. The lead Red Cross lady had to intervene. Thank you, God, that I'm out of the system now. No Red Cross or FEMA check-ins. The insanity has stopped for me. God bless the people who are in the system or have had better experiences than I have had. Traumatized for life, PTSD for sure. I think that last line is one that we really have to internalize. I know people aren't doing this, but I'm really scared that we're like, oh, we got them out of the resorts, check, everything's good. No, it's not. And they tell us over and over again in this research, the research findings. So as if I was going to turn you to something rosy, which I'm not, let's talk about healthcare more generally across Maui County. It's not pretty. In April of 2021, we had, by a 2 percentage point margin, slightly more saying that they thought the overall health of their community was unhealthy compared to healthy. That spread is now 10 points, 55 to 45 among the county, and then 20 points among our fire impacted communities. So they're saying 60% of our fire survivors are saying, I rate the all health of my community as unhealthy. Lanai, Molokai numbers are even higher. The providers say are even higher still. We also asked, do you think there are enough physicians on your island? 2 years ago, Maui was not as inclined as Lanai and Molokai to say that they didn't have enough physicians. It wasn't an exact direct question, so I don't have comparative data, but I can tell you that there are way more people on Maui saying there are not enough physicians than there were 2 years ago. And then the numbers are similar on Maui and Lanai. Excuse me. The some of you might be wondering, where's Molokai in all of this? They get their own slide. Because 97% of Molokai residents do not believe their island have enough doctors. One of my staffers has been working on this, was adamant that I make sure you understand that the other 3% of that 97 were unsure. So there was not one person in our sample from Molokai saying, yes, we have enough physicians. One of the more poignant quotes came from the provider group I did on Molokai, where they said, I said, how would you describe healthcare on your island? And they said, what healthcare? If you need healthcare, don't come. Among our providers, we have near unanimity around the lack of providers. 93% said that is the biggest barrier to accessing healthcare across the county. Lack of insurance, lack of transportation, we're also fairly high on the list. And not an insignificant number talk about language barriers and not enough clinic hours. We reported both of those findings 2 years ago. The clinic hours piece is particularly hard for folks who have to move from, travel some distance to get to medical appointments, including the people on the west side. And then the folks who are on, get paid hourly, where it takes a huge financial toll that they're going to put off healthcare because they can't get there in a way that's compatible to their ability to earn a living. The language barriers, again, something that we've reported on. We've been talking a lot about the need for homegrown healthcare, and a lot of tough times we talk about it because they know Hawaii, they're not going to get here, and 2 minutes later go, you know what, I think California looks good to me right now. And they've got, game and a stake and a vested stake in the community. The other huge advantage is that, imagine walking into a doctor and having them talk Tagalog to you, or Spanish, or having a health care, CNA speaking the language that you speak. And that's a huge benefit from our homegrown healthcare community. I've got a little good news about that, and I'll talk about it in a minute. I'm also sort of surprised that countywide, 59% saying that they can't get the care they need on their island. It's a perennial issue on Molokai, and then for those of us on Lanai, but countywide, we still have 59% saying I can't. When we looked at what's the biggest barrier to where they lived, and this is an open-ended question, we found differences across some of the cohorts. Countywide, it was a lack of healthcare professionals, the cost of insurance. When you look among our fire survivors, it was mental health concerns and healthcare infrastructure. Looking at what I mean by healthcare infrastructure, it's hospitals and clinics, particularly in the rural or isolated areas in the more isolated islands. As one Maui person said in our survey, only one hospital and an hour away and a 1 2-lane road to get there. Among Molokai and Lanai, it's our transportation woes, it's a lack of professionals, it's a lack of access to specialists. Lanai, they talk a little bit more about quality care and emergency medical services. All of this is leading to delays in healthcare, and we know that what delays mean, right? It means lack of early intervention, inability to do prevention work, and the toll that it takes on the humans who are delaying their care. We saw a 12-point jump in the number of people who said that their healthcare has been delayed since 2022. 5 points on the significant side, and then another 7 points on the slight delay side. The significant delays, the delays total, including significant, are more profound on Molokai and Lanai. But what sort of fascinated me is that we asked our providers, thinking over the past year, when accessing healthcare services for you or your ohana, were you able to get them or were there delays? And we have 81% of our healthcare professionals saying that they're experiencing delays in care. So we've got a provider shortage that's creating burnout. We have financial issues, including with our healthcare professionals, and even they can't get in to get medical appointments. It makes it hard. And obviously, it helps round out the reasons why they're considering taking off. It took me over a year to schedule a mammogram. It takes forever to get appointments to specialists. I had a kidney stone passed. It took 4 months to get an appointment. OB/GYN care here is horrific. They cannot have this limited availability for women and babies. I needed another opinion and couldn't even get one in time. When we asked folks why were there delays, they said, providers and appointments. They didn't on Lanai and Molokai though. And those of you who know me know I spend a lot of time talking about this issue, so I will not go long on this. But we have a crisis with our airline. So much so that each island has its own nickname for Mokulele. It's Modalele on Molokai, and it is Mokulele on Lanai. Airline delays were the single biggest reason for missed appointment, delayed healthcare, more generally. Another 53% said the hassles of having to go off island is a real issue. We can't get our providers in. We can't get out to appointments. HMSA reimburses patients $100. The cheapest you can get to Oahu is about $200, $220. And if you want to be sure you're going to get there, it's $320 on Lanai Air. And that doesn't include all of the other transportation costs once you get there. So people start in a deficit before they've gotten on a plane. And that, given the crisis we have with poverty, it makes it really hard for people to make that decision. And then the time away from work compounds that from a financial perspective. The other thing I talk about is what I call Mokulele shame, which is, someone will say, oh, I just missed my doctor's appointment because Mokulele was late again. And someone will say, well, did you go in the night before? And we're just like, oh, no, I probably should have. Well, the night before means a hotel stay that you have to absorb. So it gets very, very difficult for people. We have folks, persons saying that they, had to get a patient out on a C-130 from Molokai because there was, because they couldn't fit on the plane. We had some of our healthcare professionals on Molokai talking about Kapuna missing so many flights to Oahu to doctors that they've known for a long time or specialists that they're seeing, that they basically get fired by the doctor. Like, we can't take you as a patient because you keep canceling. Imagine the heartbreak and the shame that comes with that, and just the huge disappointment, and then the toll it takes. There are also folks that wanted to remind us that you're also, the Mokulele delays also mean once in a lifetime events that you miss. And I could talk a lot about that, but I think you get the point. When we look at the kinds of appointments countywide that are hardest for people to get, 2 years ago, a lot of hue and cry about access to specialists, and that was really pretty contained to that. Now we're seeing a much higher number among the primary care on countywide. That blue bar, 47% saying it's hard to get primary care appointments. On Molokai and Lanai, it's access to specialists. You see those bars off the charts, and then we don't have dentists. I'm on a 2-year waiting list, and I've just sort of decided that's not going to happen. I'm trying to floss more though. A question that we asked 2 years ago, a lot of people are feeling under pressure right now. Are you or is someone in your household in need of mental health counseling or coping with life? We have 24% of the county raising the white flag, saying either myself or someone inside my household needs mental health counseling. That number bumps to 29% with our fire impacted community. I also want to just point out my nod, nod, wink, wink question, which is the prefer not to say. We know AAPI populations stigmatize mental health, or at least traditionally have, more so than a lot of other demographics. Let's be honest, if you don't think you need mental health counseling, you'd be a no. You probably wouldn't be a prefer not to say. And so I think we can all agree that at least some of that 9% and then some of that 14% are also saying, yes, I need it, but I'm not ready to say it out loud. Our doctors have been telling us this for 2 years. Our healthcare professionals 2 years ago told us emphatically that we need counselors and we need psychiatrists. And that's the greatest need of a long list of healthcare providers, which is not to say that we don't need oncologists and rheumatologists and dentists and all the others, but that's where we see the most need. We had doctors, and I'm sorry, I'm sort of going back to something that here, I'll just wait and tell you now. The other thing that's happening is because of the access issues that people are 53% are seeing providers they know. So we have continuity of care problems. We had folks in the survey telling us that they were going to urgent care and didn't care who they could see because that was the only hope they had, or calling in and using advice nurse and those kinds of hotlines to get care because it felt like the only chance. We have had providers tell us that they're practicing outside of their specialties because they know that's the only way that these people can get the treatment that they need. Obviously, doctors are taking huge risks to do that, let alone say that, which is yet another cry for help. When you look at consistency of care, our fire impacted folks are less likely than the county as a whole to say that they see providers who know them. And more kind of in that depends category. Molokai numbers are also a bit lower. Lanai folks are more likely to say that they see providers that know them. It helps because, like, my doctor walks his dog past my house, and so I run out and talk to him. I'm sure he loves that. But you know, small community, it's easier to find the people that are caring for you. The good news is that when we ask people, are you or someone in your household interested in career training for a job in healthcare? We got good numbers. We had 13% of the county saying yes, and 17% of that fire impacted community. We went one step further and we asked those people who said they were interested, you want to give us your contact info? And 86% of those people said yes. So we have a highly motivated little data set of people who want jobs in healthcare. And the great news is a whole bunch of them are fire impacted folks who are already currently under or unemployed. The other folks countywide that are more likely to be interested are Lanai and Molokai. Across the two samples, those with a high school diploma or some college. It's also important to keep in mind that when sort of thinking about recruiting, it's not the 18 to 34, it's the 35 to 54 or the under 55 crowd more broadly. So let's not sort of narrowcast the outreach to some recent high school grads and things like that. We have people who want to switch careers. And then I looked at the list of that people, you know, that I want more information, and I saw some names, familiar names to me, and they already were healthcare professionals. So let's also not forget and I know you know this, but our opportunities for upskilling folks. Countywide, our Filipino and Pacific Islanders are particularly interested. Among our fire impacted, the Filipino and mixed Asian groups most interested. Across the board are MedQuest patients. I love this quote from one of our providers at the bottom here. I've had the privilege of serving the community that helped to raise me. It takes a village to raise a child. Now the child can serve the village. So I feel like that should be part of our marketing materials for our career outreach. Talking back to our healthcare professionals, I only got a couple more to go, is how much, looking at like how much would these things help with the healthcare problems on Maui County? They went straight to pay. Better pay for medical professionals, better federal reimbursement, better insurance reimbursement rates, better inter-island transport. When we asked them the major obstacles to recruiting new providers, it was cost of living, lack of housing, reimbursement rates, and then the isolation of location. I was talking to a recruiter from Japson 2 years ago as part of this project, and he said one of the questions when I asked people, why do you want to come and practice medicine in Hawaii? He goes, there's one answer where it's immediate disqualification. If they said, I came here on my honeymoon and I really liked it, you know, he's like, those are the people who are not staying. And that isolation of location is real especially for folks, you know, Malahini and folks who are not used to all that Hawaii offers. And then what would make your work more satisfying or rewarding? Better pay. At the top of the list, more support staff, able to deliver healthcare in a timely manner. They're also wanting to return to best practice medicine. As this person said, being allowed to practice the way I was taught, being given more time per patient visit, reduce administrative burden and non-medical people making medical decisions on care, make insurance companies dependent on providers, not the other way around. More wraparound services they talked about. In both data sets with our healthcare providers, they said there's sort of one secret weapon that we have that keeps them here, and it's the patients. The gratitude and the aloha that they get from their patients is, you know, sort of fills their cup. one has to ask, will it continue when they have hard times getting their own appointments, when they're feeling like they're not getting to practice the kind of care that they want to, when they have their own financial struggles and they're seeing, folks coming in with delayed healthcare and greater problems? I think that's a question that we should be scared to think about answering. So that's what we have. I'm happy to take questions. I know Summer's been managing all of that. Thank you for bearing through this with me. I also would be remiss if I didn't say that even if you're working in this every day, and even if you knew all the answers, this data set still could be triggering. And I want to just make sure that everyone's taking really good care of themselves.